the myths of sleep health, and I'm again delighted to be here with you all today. I plan to present for 15-20 minutes-ish and then open up for questions after that. So myth number one, and just very briefly, I know Kelly kind of went through my background. So I am trained in behavioral sleep medicine. I specifically have been trained in a technique called cognitive behavioral therapy for insomnia. So we have several studies going on that use CBTI. And so I've worked with people with multiple sclerosis. We currently have a study in older adults. So I've worked with a lot of older adults who have various related sleep issues. And so these I feel like are the myths that I oftentimes hear in the clients that I'm working with. And so I thought that would be maybe interesting and useful information for you all. So maybe one of the myths that I hear is that nothing important happens during sleep. So it sure looks like you're just laying there, not doing much, taking it easy. But we really know that sleep is a very active time for our brains and for our bodies to heal. So there's actually a lot of things that are going on as far as that repair and that recovery processes for lots of different functions. And just here's a list of the different systems that sleep helps to support. And this isn't even all of them. But we know, like, for example, for your immune system, we know that there's certain immune cells that are more prolific during the day. There's certain immune cells that are upregulated that are more prolific at night. So if you're not getting adequate sleep, it actually can impact your ability to ward off infection and viruses. We also know that sleep's important for tissue healing. And so lots of these studies have been done in animals where they'll sleep deprive the animal and compare it to a non-sleep deprived group of animals. And they find that those animals who are sleep deprived are more likely to develop sores on their paws or their tails than those animals who are not sleep deprived. And so as a physical therapist, we see a lot of clients who have had some sort of an injury or have had surgery. And so to me as a clinician, that's so important, knowing that sleep is critical for that tissue and for that body to heal. We also know that sleep's very important for pain and regulating our response to pain. So when you're not able to get into that deep restorative stage of sleep, which we call slow wave sleep, it actually impacts the ability of the brain to regulate your perception of pain. So people who aren't getting adequate sleep, they have a higher pain perception, they have a lower pain threshold, maybe are indicating that they experience pain at lower levels. So really fascinating work going on the relationship between sleep and pain. We also know sleep's important for cardiovascular health. So when you get, again, into that deep restorative slow wave sleep, that's a period of time where you have a lowering in your heart rate, you have a lowering in your blood pressure. So it puts less strain and stress on that cardiovascular system. So if you're not getting adequate sleep, again, it just puts added strain on your cardiovascular system, which puts you at a higher risk of developing cardiovascular disease. We also know sleep's really important for cognitive function. And cognitive function refers to lots of different domains. So things like paying attention, being able to switch attention, being able to make higher level decisions, and sleep impacts each one of those domains. We also know that sleep's really important for learning and for memory consolidation. So there's been studies that have shown that what you learn during the day, in essence, gets replayed at night, which helps to strengthen that memory consolidation and holding those memories within your brain. We also know sleep's important for metabolic and endocrine functions. So if you're not getting adequate sleep, it puts you at a higher risk of developing diabetes and obesity. Of particular interest to me in my research lab is looking at how sleep is important, how it's neuroprotective, and how it can actually help you eliminate waste that can build up during the day. So one example is beta amyloid. That gets produced as a byproduct. And ideally, when you're in that deep slow wave sleep, there's an increase in fluid that flows through your brain, and it helps to clear out the beta amyloid. So if you're not getting adequate sleep, you're at a higher risk of that amyloid, the beta amyloid, staying in your brain and putting you at a higher risk for developing Alzheimer's disease. So we're using a strategy called cognitive behavioral therapy for insomnia to help people sleep better. And we're looking to see if does that improve cognitive function, and also does it reduce the rate of beta amyloid accumulation within the brain. We have about 1 more year to go on that 5-year study, but I'm really excited to see the results once we actually finish enrollment and are able to look at that analysis, because obviously that would be huge impact if we're able to support what we are hoping we'll see. Another myth that I see oftentimes in clients that I've worked with is that older adults need less sleep. And this is not true. The need for sleep does not change as you age. So the recommendation from the American Academy of Sleep Medicine is for adults to get at least 7 hours of sleep or more for adequate health. And it may be that if you do feel like you're getting less sleep or maybe you're needing more sleep, sometimes that can indicate that you possibly have some underlying health issue that could be going on. And I like this infographic because it helps to relay there are changes that happen in your sleep, but the need for sleep doesn't change. So on the top of this picture, it shows a stereotypical general 18-year-old. And if we look at his pie chart here, what we see is that about 50% of his night of sleep is by stage 2 sleep. And we'll talk a little bit more, I think, on the next slide about these different stages, but about 50%. And you'll notice that doesn't change in older adults as well. And he spends about 20%-ish in delta sleep, which is another word for slow wave sleep or that deep restorative stage of sleep. And so you will notice that there is, in general, a reduction in the amount of time that older adults spend in that deep slow wave sleep. So that is one change that we oftentimes do see in older adults. Another change that we see is you'll see for the stereotypical 18-year-old, he's not spending a whole lot of time awake throughout the night. And even if we look at the picture of these different sleep stages across the night, it looks like he's getting 8 hours of sleep, we see just a couple white bars indicating that he's becoming awake during the night, which is typical. People roll, people maybe have these micro arousals, that's normal. But what we see in this older gentleman that's lying here below, he's spending more time awake than what a younger adult would. And again, you see more of these white bars happening throughout the night, indicating these arousals are more prevalent throughout the night. And then the other change you'll see is an increase in stage 1. So where the younger adult is spending a very little amount of time in that stage 1 sleep, which is the very light stage of sleep that we go into when we first start to sleep. We see that older adults oftentimes spend more time in stage 1. So again, older adults often have more awakenings, they have more of that light stage 1 sleep and less of that deep stage 2 sleep. But I just want to illustrate here too, again, in this gentleman, he's getting 8.5 hours of sleep. So yes, duration of sleep is one thing that we think about, but we also want to think about quality sleep. Because again, he may be getting more duration than the younger adult at 8.5 hours, but looking at his sleep, I'd say, well, this isn't as great because he's having more awakenings in this picture here. So another myth that I oftentimes hear is that being able to fall asleep anytime, anywhere is a sign of a healthy sleep system. Not so. Oftentimes, if somebody is saying that they're falling asleep watching TV frequently, I've had some people say that they'll doze while they're waiting at a stoplight. Obviously, that's a big concern. But oftentimes that indicates that they're not getting adequate quality sleep at night. Which again is a concern. And I oftentimes am thinking about, could there be an underlying sleep disorder? Could there be an underlying health issue that could be contributing to their disrupted sleep? And so what this picture shows is I think it's helpful to learn a little bit about what are the processes that underlie our sleep. And so for humans, we have two processes that drive our sleep. We have process C, which is our circadian rhythm. You've probably heard of that one before. And then process S is referred to as our sleep drive. And our circadian rhythm is regulated by the suprachiasmatic nucleus in our brainstem. And that tells a part of our brain to secrete melatonin, which has our brain switch from being awake from being asleep. So melatonin is a very potent hormone in humans. So process C is very important for our regulation of our sleep-wake cycle. And then process S, again, that sleep drive. So you can think of it as the longer you're awake, the more active and cognitively active you've been, the higher your sleep drive is going to be. So we want the circadian rhythm, we want the sleep drive to be super high so that people are going to be successful to sleep. And so oftentimes, if someone's able to fall asleep anywhere, anytime, usually that means that their process S is super high. and they're not getting adequate sleep at night to reduce the sleep drive. Because what should happen is you get into bed at, say, 11 o'clock in this picture, and in that sleep drive, we see a really significant reduction in the sleep drive. Then you wake up and you're trying to build the sleep drive back up the next day. Another myth, if you have difficulty falling asleep, it is best to stay in bed and try to fall back to sleep. And I love this picture because, here's this person laying here to say, you woke me to say this, and here's his brain, next to him, thinking about all these things that could be going on and waking him up and keeping him from falling back to sleep. And so in general, our recommendation is that if you aren't able to fall asleep within 15 or 20 minutes, and that's what feels like 15 to 20 minutes, because we of course don't want you staring at a clock, the general recommendation is actually to get out of bed and to go somewhere that you can do a relaxing, distracting activity. Because ideally, we want your brain to associate your bed with sleeping. We don't want your brain to associate the bed with this picture, with your brain thinking about all these things, worrying about all these things, having all these thoughts still going through your head. Because then what can happen is then you get into bed and your brain is like, oh, this is the time to worry. This is the time to think about things. So we try to break that cycle. Of course, for some of our clients, if they have mobility limitations or we're concerned about fall risk, then those are the individuals that we actually say, don't get out of bed. We don't want to risk having you fall. And instead, we encourage them to do a relaxing, distracting activity in bed to help, again, retrain the brain to think bed equals sleep. So another myth, and this is a conversation that I have with quite a few of my clients. The myth is that alcohol before bed will improve your sleep. Not the case. It may help you relax and may help you fall asleep more quickly, but it's actually going to disrupt your sleep and make you wake up more often throughout the night. And so this is where I have the picture of what our typical sleep schedule or sleep cycles look like. So for humans, we cycle through REM sleep, and then there's 3 stages of non-REM sleep. So stage 1 I had mentioned before, stage 2, stage 3, and that goes in level of depth. So stage 1 is the really light stage of sleep, all the way down to stage 3 is that deep restorative stage of sleep. And so as humans, we cycle through those different stages throughout the night, anywhere between 4 to 6 times, anywhere between 60 to 90 minutes. So here in this example, the person is going to sleep or going to bed at 11 p.m. and is waking up at 7 a.m. So they are in bed and they go and first spend a little bit of time of stage 1, which again is that first stage that we enter before we fall, or as we're falling asleep, then spend a little bit of time in stage 2, and then spends quite a bit of time in that deep stage 3 sleep. And then you'll see cycles back up to stage 2, spends a little bit of time in REM. So the REM is denoted with this little bit of a red line, and then they cycle back down into deep sleep. And then here he has a little awakening, but then quickly falls back to sleep in that deep stage. So what you'll notice is, yes, they're cycling through these different stages, but we spend more time in that deep restorative stage of sleep in the first half of the night, and more time in that those lighter stages and REM sleep in the second half of the night. So that's why it's actually harder for someone to wake you up in the beginning of the night than it is at the end of the night or early morning. And also, too, if you wake up in the early morning hours, you're more likely to remember your dreams, because most of our dreaming happens during REM sleep, and it's a lighter stage of sleep. So if you wake up, you're more likely to remember your dreams. But again, alcohol will actually disrupt your sleep, and you'll have more of these awakenings periodically throughout the night. And another myth, napping makes up for lack of sleep at night. So I teach in our physical therapy program. I hear this actually a lot from our students that, oh, I stayed up all night studying last night, or I didn't get much sleep last night, because I'm studying for a test. That's okay. I'll just nap today and make up for it. And it's like, well, yes and no. You can't actually make up for the processes that should have happened while you didn't get enough sleep last night. But yes, it may help with your brain fog. It may help enhance your performance, but it's not going to actually make up for your lack of sleep last night. And so here's what happens though when people nap. And this is why napping, we oftentimes encourage people to either try to avoid napping or if you do need to take a nap, to try to take it as early in the day as possible, because I mentioned sleep drive, right? We want that sleep drive to build up during the day. So then when you get into bed at night, you fall asleep really quickly and easily because that sleep drive is super high. Well, if you take a nap, it's going to reduce your sleep drive. You're going to have a dip in that sleep drive. And so just know that if you do take a nap, you likely are going to have to delay your bedtime so there's sufficient time for that sleep drive to build back up so it's adequately high for you to fall asleep quickly and easily. But just to reiterate, yes, it may help kind of with your performance. It may help kind of with a little bit with that cognitive fatigue, but you can actually make up for the processes that should have happened the night before. And then the last myth, and this is, well, I'll wrap up and then I'll take some questions. So myth number 7, and this is really what we focus most on within my lab, is the myth that sleep issues are a normal part of aging. There's not much I can do about it. And this is something that I really want to break this myth, because sleep issues are not a normal part of aging. Like I mentioned, your need for sleep doesn't change. Yes, we see some characteristic changes in sleep architecture, but having sleep issues is not normal. And so I encourage clients to talk to their physician to see if there's an underlying sleep issue, if there's an underlying medical condition. Oftentimes medication can also be disrupting sleep, but just know there often are things that can be done to address those sleep issues. And I'm going to talk a little bit about those here as well. So these are the pillars of sleep health promotion. And so we try to address with all of our clients these 4 pillars. So we want to train circadian rhythm. So I mentioned it, circadian rhythm and sleep drive are the 2 processes that drive our sleep as humans. So we want that circadian rhythm to be as strong as possible. We want our sleep drive to be as high as possible, but we also want to reduce pre-sleep arousal. And I mean kind of that nervous system activity, that brain activity that just our brains want to run and won't turn off, because you can have a really strong circadian rhythm, you can have a really high sleep drive, but if you can't calm your body and you can't calm your brain, then those 2 processes aren't going to be able to be effective. So we also spend a lot of time with our clients working on reducing pre-sleep arousal. And then the 4th bucket or 4th pillar, we refer to as sleep hygiene. And these are kind of all the other things like avoiding alcohol, avoiding nicotine, those sorts of things. And I have that in an etched line because typically, yes, we want to talk about them and yes, we want to address them if they're present, but they are not usually the sole factors influencing someone's sleep health. Usually it's circadian rhythm, sleep drive, or arousal issue. But yes, we'll also mention and talk about sleep hygiene as well. So what are ways that you can entrain your circadian rhythm? So one of the best things that you can do is have a regular sleep cycle. And I always emphasize a regular wake-up time with my clients because if you have a regular wake-up time, what's going to follow and develop is a regular bedtime. And the reason why regular wake-up time is key is exposure to light, and ideally exposure to sunlight, because there's a direct connection from your eye to that area of the brain that's secreting melatonin that tells your brain, hey, it's time to stop secreting melatonin and it's time to wake up. So ideally making your bedroom or where you're sleeping as dark as possible. And then when you wake up in the morning, expose yourself to bright light. That will help train your circadian rhythm. The way that we increase sleep drive, and I think about this as like a balloon, or you can think about that picture where you want the sleep drive to be super high. So I've already talked about this concept of stimulus control, meaning we want your brain to associate the bed with sleep. So if you're tossing and turning, ideally you're getting out of bed if it's safe to do so. We've talked about limiting naps if possible, because again, if you want that sleep drive to be high and then you take a nap, it's going to make the sleep drive dip. But just know that if you do take a nap, you may have to delay your bedtime later than you typically would. And then of course, physical activity and exercise, you all know that's good for you. It's also good to help your sleep as well. And it helps by increasing your sleep drive. And then the ways that we reduce pre-sleep arousal, I encourage my clients to develop a relaxing bedtime routine. So just like we want the brain to associate the bed with sleep, this bedtime routine also tells the brain that what comes next is going to be the bed, which equals sleep. And it also allows us a time to calm our bodies and to calm our brains so the circadian rhythm and the sleep drive can do their thing. And then I also focus on relaxation techniques with my clients throughout the day. because yes, sleep oftentimes happens during the nighttime hours, but our whole day is 24 hours. So what we do during the day is going to matter. And ideally, we're not waiting till right before bedtime to think about how do we manage our stress, our worry, those sorts of things. So I have clients practice during the day. And then as far as sleep hygiene, so those are thinking about your environment, try to keep your sleeping environment dark, cool, calm, and quiet. We talked about limiting caffeine, limiting alcohol, and avoiding large meals because that can upset your stomach and make it difficult to sleep. And then avoiding excessive liquid. Yes, by all means, stay hydrated, but not consuming more liquid than you need to reduce the number of times having to get up to use the restroom.